Today's topic is the protection of privacy. Baruch and Cecil have defined privacy as persons' interest in controlling the access of others to themselves. Understood in this fashion, privacy is most directly related to the principle of respect for persons. It's respect for persons that requires us to obtain informed consent, and informed consent allows people to control the access of others to themselves, whether this is access to their bodies and clinical research or access to their data. But the protection of privacy is also related to the principle of beneficence, insofar as beneficence requires us to minimize harms. People can certainly be exposed to many harms when privacy is breached: economic harms, social harms, or the harm of embarrassment. Once we agree that we need to protect privacy, the question arises, how? And at what cost? Do we need to avoid asking certain questions? Do we need to hire consultants at times to help us protect privacy? And within what boundaries? Are there times when researchers are obliged to breach confidentiality? And who has a right to access the data of other people? These questions have become even more acute in an electronic age.
Yes, Jim. It wasn't long ago that scientists kept research data in manila folders and locked file cabinets behind their desk. Today, data is stored in multiple electronic formats, including CDs and on hard drives and in data warehouses, and is accessed through electronic networks. Also, researchers have growing access to sensitive health data for people that have mental illness or substance abuse or HIV. As the Harvard University law professor Arthur Miller says, it's like this genie springing out of a bottle, going anywhere in the world and for any purpose whatsoever. As the federal government begins to implement new protections for the electronic age related to privacy, we have to realize that research participants may not be persuaded that better services and new cures and medications are sufficient for them to take risks to their sensitive health data.
Our interview today is with Dr. Dorothy Webman. Dr. Webman is a social worker and the president of Webman Associates. She's also the founder and chair of the Work Group for the Computerization of Behavioral Health and Human Services Records. She's consulted with a number of government agencies on the HIPAA privacy rule and the protection of electronic records. I began our interview by asking Dr. Webman why she feels so passionately about the protection of privacy.
The consequences of privacy violation can simply be enormous. People lose jobs, families, friends, homes, entire lifestyles due to one privacy violation. That's an incredibly powerful concept, and it should guide all of our thinking in the design, implementation, and follow-up processes of research. It's particularly true with special populations and those with behavioral health problems, where stigma in this country runs absolutely rampant. People have this idea that if they have good values and they're ethical researchers, then they know how to protect people's privacy, how to protect their information, that they will in and of themselves become the repository of this confidential information, and somehow it will never be damaged. But that's not really the truth. They have to do more than just be good people. They have to do more than value that person's secret. They have to actually go out there and find the tools that ensure the protection of that data.
What are some of the ethical values that underlie our commitment to protecting privacy?
Number one as a researcher is do no harm. Number two as a researcher, you hope, is to provide a piece of information that's going to serve the public good. And so you have to be able to balance those two things. You have to be able to balance the effort to gain and obtain information that's going to benefit society and benefit the individuals in the study, and at the same time not to harm those individuals or use their information in any way, shape, or form that can have any long-term or short-term negative ramification for them.
What are some of the resources and tools that researchers can turn to in their efforts to strip data of identifiers?
There are a number of ways to anonymize data. Some of that has to do with so-called blinding of the data, figuring out ways to de-identify the data. What do I mean by that? What do I mean by that? I mean that you're going to try to figure out a way, a technical way of manipulating that data so that I don't know that this data is about you, Jim, right? I'm going to strip that data of your name, of any unique identifiers about you, perhaps your zip code, perhaps your address, perhaps your birthday. And those are efforts to anonymize or strip that data of identification of you as an individual. There is no one technology or method right now for completely stripping data of identifiers. And it is very, very, very easy to re-identify data and to connect information about you in other ways to re-identify you in a data pool, Jim. There's famous cases, a WebMD Quintiles case, where it was proven that a set of data inside a corporation could be matched up against publicly available databases, and that more than 80% of the parties in that database were re-identified by simply matching and merging data sets. So it is a very, very simple activity if people want to go about doing that activity and they get their hands on those data sets legally or illegally.
With IRBs, they're often encouraged to involve community members on the IRBs, researchers in the relevant field. And I think the point you're making might lead to the idea that we also need very sophisticated statisticians and people who are familiar with databases to determine whether or not data really is blinded when researchers claim it will be.
Yes, we need more statisticians to get very interested in solving this problem. And we need to have them work hand in hand and mind in mind with technology experts and engineers to try to, once and for all, help us solve this problem for the well-being of all people.
One of your work groups created a slogan that in many ways articulates this balance that you're talking about. What is that slogan?
Is as much as necessary and as little as possible, right? Now, there's a reason for that slogan, a very, very serious reason, is that if you think about any consumer of healthcare services, be that mental health services, substance abuse services, social services of any kind, physical healthcare services, preventive healthcare services, in general, you want to tell a doctor, a social worker, a lawyer, anybody you think can help you, whatever information they need to have in order to make a good decision and or a set of recommendations that might in fact help you. But you don't necessarily want to tell them anything that's extraneous, private, secret to you. This phrase and slogan gets at just that. Consumers' recognition that yes, it's necessary for me to disclose a certain amount of information and for me to allow a provider to disclose a certain amount of information to another provider, that I give my permission for that disclosure for, right? And that will be okay because that's in my best interest. People can extend that to seeing a community best interest, that it's okay to collect data about a community, a minimum amount of data, in order to get your hands on the pulse of the well-being of that community. But they, generally speaking, would prefer to be asked whether or not it's okay to ask those kinds of questions about themselves or about that community. They would like to be able to give permission to give information about themselves or about that community, and then they want to be able to see the proof in the pudding. They want to see that, in fact, the information you asked was absolutely necessary in order to figure out how to best help the individual or the community.
How can researchers protect privacy when they're conducting research in open settings, like in bars, maybe out in parks. They're trying to recruit people for an outreach study. This is frequently done maybe when you're studying substance abuse patterns or maybe HIV, things like this. How can you protect privacy in these situations?
Again, Jim, it's all about respect and building trust. In some ways, I could tell you a million different cool ideas about ways to protect people's trust in public settings, and I'm going to tell you a few of them. But the real bottom line is reality. If you or I are standing in the middle of Times Square, Harvard Square, downtown St. Louis, there's no way that 10 people go by and say, excuse me, you want to be in my research study. They're not going to know, the person who just left you and said yes or no, that the other person who stops and talks to you didn't just say yes. They did. And so they're there. When you're in a public setting, it's very, very, very difficult, if you're approaching people publicly, to really and truly protect their anonymity in the situation. And that's very different than protecting their privacy. Protecting their privacy about the information that they choose to tell you or not tell you. That's a very, very different thing. People may know in a public setting that that person has agreed to participate by virtue of the fact that they stopped and they're talking to you. If you decide that you're going to hand them written information and say, excuse me, will you look at this even? That may be one way of minimizing that information, but still you have the person who walked by and didn't go on, and they already know what you're doing and what you're up to. It's a very different thing that once they said, yes, I'll stop, I will participate, I will talk to you, and I'm going to share some information with you, then you do everything that you should do as an ethical researcher. You give them information about the study, you tell them what's going to happen to that information and how you're going to treat it in capture, storage, and transport, right? And you're going to do everything you can to put that person in as isolated a setting as possible, even though you're in public. You're doing, one of the things, I did a lot of street outreach actually in my direct service experience, and I did do that in the area of HIV prevention. And very often in HIV prevention and gang outreach, street outreach, we've learned that you want to try to create those private spots in public places to ask these sensitive questions. So trying to find the little corner of a laundry room or having a mobile van, for example. A lot of researchers don't think of things like trying to write into their research projects things like mobile vans so that there is a little spot to walk away from when you're the person in the street and they're not just standing there and doing that right there in the middle of the street.
It's interesting when IRBs approach the topic of privacy, and I think researchers as well, they typically focus at the level of dissemination of the data. They're looking at what will it look like when it appears in an article, in a publication, or when it's presented at a conference. And yet you're focusing in many ways at things that happen prior to that and after that. You mentioned data capture, transport, storage, archiving, and destruction. Can you tell me a little bit about each of these, starting with data capture?
Talked a little bit about that over the course of this dialogue already, and how important it is to engage the trust of the participant at the point of data capture. Where you place that data and how much information you give the participant about where that data is going right then and there. For example, when they sign their informed consent form, where does that go? Does that go in an envelope they get to seal and protect and then put in a safe and secure locked place? Or do you take that away to some unknown destination? Have you explained that to them? That's one way of showing your compassion for the person at the point of capturing their information. The large-scale database level, that's a different story. When you're drawing information from other sources, for example, some sort of secondary analysis, you're going to pull data from a Department of Social Services, from a local hospital, from a publicly available data set like a census data set. You're going out there on the net, you're grabbing down different pieces of information from different places. When you're doing that, there's a danger. On one end, it's their storage capacities. How they store and protect their data is something you have no control over unless you set up some sort of business agreement with them from the beginning of your study. in your research design about how you're going to exchange data with them, how that data is going to be secured on their end and secured on your end and secured in between that exchange.
It seems that whether we're talking about the very beginning of research and we're trying to determine how many questions to ask, how many demographic variables, let's say, to investigate, or we're talking about the analysis of data, which fields to include in our analysis, we see a conflict between the interests of science, where researchers want to test certain variables and hypotheses, and the interests of the participants to protect their own privacy. Do you have any guidelines, or is there any principle for balancing these two different interests?
What if it were me? What if that were my private information? How would I want that information treated? I would want that information treated with the utmost care. I would want to share all of the information necessary to properly inform the researcher, help the researcher reach the conclusions that he or she needs to reach, to give me back information about how to improve the quality of my health care, the quality of the service system available to me. By the same token, I would want the same thing for my community. If I'm asked to give up information about myself for the greater good of my community, I want to give up the amount of information that's necessary to improve community-based public health standards, and not a stitch more.
Dorothy, drawing from your years of experience consulting on this topic of privacy protection, what do you think is the single biggest improvement we can make in the way that we protect the privacy of participants in research?
The first thing I have to honestly tell you is that there is no one magic bullet. This is a multi-dimensional problem that in the age of technology gets more and more complex every day. Therefore, we need a thoughtful, multifaceted set of solutions to address all the dimensions of this problem. It's very, very clear that in this country, we lack public consensus about the solution. We don't lack public consensus about concern. Concern about privacy protection runs rampant and high. How to solve that problem is something that Americans in general are not very well educated about, and they have not been involved in the dialogue about how to do that. So a public awareness campaign about privacy protection options, I think, is one way to go about this.
Well, Jean, as you know, in this post-HIPAA era, there are many researchers who are rather upset about some of our regulations. Some are up in arms, feeling that the new regs have placed an administrative burden on them. Some are skeptical about whether the regulations will achieve their intended aims.
And they begrudgingly comply with those regulations, too.
Exactly. And I think that this interview reminds us that the important thing is not just compliance for compliance sake, but really refocusing on the ethical issues, on showing respect for participants, preserving trust, and that also affects the integrity of data that we get, and protecting people from very real harms that can ensue from breaches of confidentiality.
Yeah, I think it's clear that the biggest challenge to confidentiality of research records is the attitude of the researchers. And if you look at the use of low technologies in research data, you find that inadvertent breaches occur often, such as leaving questionnaires beside a Xerox machine or left at a fax machine that's sitting out in a public area. One time, I found boxes of questionnaires just stored under a table, and I reminded the researchers that this was really a breach of confidentiality, and in their informed consent, they had told people that they would be kept under lock and key, and they had just totally overlooked this and were somewhat taken aback. And I began to think, why do I care so much about it? And I think it's because as a mental health consumer, I really see the data as human beings, as their personal effects. And I think that researchers don't connect the person to the statistics, to the numbers.
Yeah, Gina, I think you're absolutely right. People who know me know that I'm a slob. My offices tend to be a mess. And so this is a really important point, that ethics isn't just about theory or personal commitments, but also about habits and mindfulness and asking yourself, what if it was my data?
Yeah, in the first discussion group, we find that people with psychiatric problems clearly are concerned about the confidentiality of their health records, and that they feel, on the one hand, they have a responsibility to share this information in order to advance science, but they are also concerned because it's the researcher's responsibility to keep that information safe. Do people here worry about the exposure of their psychiatric records? Are you worried about that, that someone will see those that shouldn't be seeing them?
Yes and no. When you look for employment, it's not allowed for the employment application to dip into that. Have you ever suffered from a neurological disorder? Have you ever been in a mental hospital? That's disallowed by law. However, and certainly if I were looking into my past employment history, I would take special care to fill those voids where I might have been hospitalized or treated privately with something interesting other than mental hospital. But on the other hand, I want to advocate against the stigma of mental illness, because that's part of my nature and that's part of my present profession. So there's a duplicity there in a very real sense, what I'm doing now. And also, when going into surveys is part of the advocacy process, because basically it's a public interest. So yes and no.
How about other people here? Because you could be taking a risk in being involved in research, that your psychiatric records, or people could find out that you were a recipient of mental health services. Do people here worry about that at all?
But mostly every time you do anything like that, it's a risk. You're taking a risk and you're taking a chance.
All that's supposed to be confidential. Now, I'm not saying it is, but I'm saying at least whoever the researcher is has a responsibility to try to maximize the confidentiality as much as possible. That's his ethics. Am I right?
With the computers now, there's no more confidentiality. No one's safe.
The second discussion group shows the potential of a chilling effect due to inadvertent breaches of confidentiality in terms of people seeking services or participating in research. Also, people may not tend to tell the whole story or to tell the truth, that they think they're going to be harmed or their friends or family are going to be harmed, or that Big Brother is watching. If you're answering a survey, do you always answer the survey exactly right, or are you afraid sometimes that your answer could hurt you?
I mean, you know, one thing that crossed my mind, when they're asking you all these questions, I mean, quite frankly, if you, a prospective employer, can find out everything about me, whether or not I've ever been in a mental hospital, if I've ever been in a drug abuse clinic, you know, now called drug rehabilitation, then what's to keep the government from coming in and looking at these records, you know, invading the computer and finding out who is in fact the big crackhead, who is the big heroin user, and pinch him out on the street, you know, I mean, down the road, you know?
I would think it all depends. It may depend on your mental illness, whatever your diagnosis may be. You know, for me, I'm depressed. So I'm not too concerned. There are studies that's out now that say the majority of Americans go through some form of depression. So it's no social stigma attached to my mental illness. You know, whereas a person who may be manic depressive who has some homicidal tendencies, you know, right, paranoid schizophrenic, they may not be willing to come forth with information readily so, as, you know, as much as myself. See what I'm saying? So, I'll leave it at that.
Is that important to you, that the researchers follow certain precautions and they are careful with the data that they've collected from you?
I'm looking at it like this here. You're here for a purpose to collect research, you know, from us. We're giving you the answers that we're supposed to do. So you're supposed to use this information that you can to help study your, to help, I guess, progress, move your research on to other levels. When you do research, it's here to help your research study, help what mankind on with his medication. I mean, say medicine field and stuff like that. So if it wasn't for, you know, people like us, involvement in research study, how could the world become a better place anyway without willing to give up that type of information?
This discussion group also, I think, showed that the expectation of privacy can enhance consumer trust and can build the relationship between the researcher and the research participant.
Sure. I think it also showed, though, that they're aware of the fact that there are also outside forces that can affect the confidentiality of data. Well, one of our participants mentioned a fear that research data could be used to lead to an arrest, for example. And they're right. That can happen. And I think researchers need to be aware of these risks and to make extra efforts. For example, in research that could put someone at risk of arrest, we can get certificates of confidentiality that would enable the researcher to withhold the data even in the face of a subpoena. There are limits, of course, to the protections that it can offer. If someone reports abuse of children or the elderly, for example, researchers are still obliged to report that.
Well, also professional organizations for psychologists and sociologists vary on what you're required to reveal. In a interview process, oftentimes questions can emerge such as how suicidal you are. For psychologists, their code of ethics requires that that person be taken to a health provider or the mental health system be notified. On the other hand, sociologists, their code of ethics says that you have to maintain the confidentiality of the interview process.
Well, I think, again, Jean, this leads us sort of full circle to certain protections that we can offer. First and foremost, this motto of gather just as much data as necessary and as little as possible. Perhaps we shouldn't be asking certain questions that would put people at risk when it's not necessary.
Exactly.
And the other point being informed consent, that we need to inform people not only that we will protect their data, but inform them of the limits to these protections. And this enables them then to make a choice whether or not to participate and whether to protect themselves in the process of participating by refusing to answer certain questions.